everyone, my name is Julia Menina. I'm a student nurse practitioner. I'm here with my patient. Julia, what brings you in today?
Just annual exam.
Okay. My patient, Miss Julia, is a 40-year-old female. She presents to the clinic today because it's her just physical annual exam. She's alert and oriented. She's in no acute distress. She's well groomed. Her speech is clear and coherent. She maintains eye contact during conversations. So we're going to start out with the head right now. Start by looking at the head and face. It's symmetrical. There's no lesions or lumps visible. I'm going to assess for the cranial nerve 7 right now. So it's the facial nerve, and I'm going to ask the patient to smile for me. Okay, very good. Frown. Can you close your eyes for me? Okay, and now can you puff your cheeks for me? Okay, very good. We're gonna continue on. I'm gonna take my gloves and put them on and palpate the head. We're gonna start by palpating the head. We're gonna start anteriorly and move our way back. So I'm palpating the head. There's no masses, no lumps, no lesions. With a patient who has hair, lots of hair like this, you're gonna lift up the hair to look at the skin breakdown. So there's no skin breakdown noted. There's no lice. Say everything is normal there. That part of the palpation is complete for the head. So then we're gonna continue on, and I'm gonna be palpating the temporal artery. So it's located right here, and the temporal artery is present and +2. Now I'm gonna be assessing for cranial nerve 5, which is the trigeminal nerve. And with this, I'm just gonna have the patient open your mouth and close. Good. Now over here it's the masseter. So now I'm gonna be testing for the TMJ, which is the temporal mandibular joint. So I'm gonna have the patient open and close her mouth. Close. Here, there's no presence of any crepitus, crackles, or popping, which is normal. It should be. Palpate the sinuses. So here, maxillary sinus, any pain?
No.
Any tenderness?
No.
What about here? This is the frontal now. Let me move over so it could be seen. The frontal. Any pain?
No.
Any tenderness?
No.
Okay. So looking at the eyes itself, the eyebrows, hair is evenly distributed on the eyes, on the eyebrows. There's no swelling on the eyelids. There's no redness on the eyelids. Sclera is white. The iris and pupil are intact. I'm going to look at the conjunctiva by pulling down her eyelid, her eyes here, and patient's going to look up for me. So just look up for me. Okay, very good. Conjunctiva is noted to be pink. No exudate present, no drainage coming out from the eyes. There's also no foreign bodies of any sort or anything visible in the eyes. So that was with that. Now I'm going to take my Snellen card to assess for visual acuity. So I'm going to have the patient read the bottom line on here. You're going to close one eye for me.
OLCFA.
Okay, and then the other one?
OLCFA.
Okay, very good. So that's testing for visual acuity. Now I'm going to continue on, and I'm going to be assessing the patient for cranial nerves 3, 4, and 6. 3 is her ocular motor nerve, 4 is her trochlear nerve, and 6 is her abducens. And by this, there's a few different tests for it. The first one we're going to start out with is by patient looking at the top of my pen light, and I'm going to be moving it in different directions, and all the patient is going to do is just follow that pen light. She's going to keep her head still and not move, okay? So we're going to start here, look at the top of my pen light, and just follow my pen light. Okay. Okay, very good. So here we tested for nystagmus. That's any kind of involuntary twitching of the eye, which my patient did not have. We're going to move on now to testing of the reactivity to light. So what I'm going to do is I'm going to be shining in the light onto my patient's eye. She's going to focus on an object at distance. When she does that, her pupils are going to be dilated. So she's going to focus on an object, and then when I'm going to be coming in with this pen light, her pupils should constrict. So they're dilated now. A normal pupil size is between 3 millimeters to 5 millimeters. My patients right now are about 3. So I'm going to be coming in, and they constrict, and same from this side, and they constrict. Now I'm going to be testing for accommodation. So with this, I'm going to have the patient look at the top of my pen light, and I'm going to be moving inward towards her nose with this pen light. And what we're looking for is her eyes are constricting and they cross over and they accommodate. So look at this, and I'm going to be moving inward. And so with that, we tested for Perla, which is pupils are equal, round, reactive to light and accommodation. So with that part of the eyes, we are done. Now we are going to move, oh no, we are not done. We are going to do the ophthalmoscope, and I'm going to be checking for the red reflex. So you shine the light in the patient's cornea, and when you do so, the light should reflect back red. It's normal. And I'm going to be going in now to observe. All right, so red reflex present. We see the optic disc there. It's yellow. There was no fuzzy, no wool, cotton wool spots. Retinal background and vessels were clear and concise. So now I'm going to be going in from this side. Same with this side. So, retinal vessels were clear to see. Now we finished the eyes now. So now we are gonna continue with the ears. We start at inspection. Skin color, no redness noted, no lumps, no dryness. Same here, no redness, no lumps, no dryness. I'm gonna touch the tragus, put pressure on it, and patient's gonna tell me if she feels any tenderness. Do you feel any tenderness?
No.
Okay, so that's good. Now I'm going to be looking into the tympanic membrane, and when you do so, you should be seeing a pearly gray translucent color. So with that, with an adult, you take the pinna and you pull it up and back, whereas for a child, you would pull it down. So let me connect my otoscope and turn it on. Okay. So I'm going to be taking my patient's pinna, moving it up and back. See good. I see pearly gray translucent color in there as it should. I don't see any kind of drainage and nothing like that. Then I'm going to do the same on this ear. Okay, no drainage noted. No lumps or anything noted in there as well. Then I'm going to be testing for my patient's cranial nerve 8, which is the vestibulocochlear nerve. And by doing this, I'm going to be doing a whisper test, and this is to test her gross hearing. So I'm going to be standing on the side of my patient. I mean, cover my mouth so the patient doesn't see from her peripheral vision. So could you please hold your tragus in, and then I'm gonna be whispering you a word, and it should be at least 3 syllables, and then you're just gonna repeat it back to me. Okay?
Ambulance.
Okay, very good. And then I'm gonna do the same on this ear. So yeah, hold the tragus. I'm gonna cover my mouth once again, and
Hospital.
okay. Very good. So now I'm going to continue on with the Rhine test and Weber test. So with the Weber test, it's a test to measure bone conduction. And with this, you use a tuning fork. This one is 512. I'm going to be putting it to the top of my patient's skull, and she's going to note to me whether she hears it in the left side, the right side, or equal on both sides. So to do this test, I want to strike it against like an elbow or a knee. I'm going to start off, and I'm just going to be placing it up, okay?
From both sides.
You hear it from both sides. Okay, as she should. So my patient was able to hear from both sides. This is a normal test. Now for the Renee test, I'm going to be striking it again, and then I'm going to be taking the stem of this tuning fork, and first I'm going to put it on her mastoid, and then I'm going to put it about an inch away, and I'm going to tell her to tell me stop when she stops hearing it. And each side is performed separate as well. So, wait. Okay, you put it to the mastoid, tell me stop when you stop hearing it.
Stop. Stop.
Okay, good. So the air conduction is twice as longer than the bone conduction. And I'm gonna do it to this side too as well.
Stop. Stop.
Okay, very good. So patient was able to identify when, it stopped. So there we finished with the ears. We are gonna now continue with the nose. And when we look at the nose, we look at the nose as midline in the face, symmetrical. I'm gonna be testing for the patency of her nose. So I'm gonna have the patient close one nostril and breathe in and breathe out, then close the second nostril and breathe in and breathe out. So close one for me, please. Okay, very good. And now close the other. Okay, very good. So we tested for the patency, and she was able to breathe in and out, no occlusions. Just also by looking at it, I don't see any drainage coming from the nose, no bleeding. Okay, I'm gonna take my pen light just to take a look, and I'm gonna have the patient tilt her head back a little bit. All right, and once again, there's no drainage. The septum isn't deviated, it's intact. Yeah, now to test for the cranial nerve 1, which is the olfactory nerve, I'm gonna ask the patient to smell something, and she's gonna tell me the smell of what she smells. So, can you close your eyes? Very good. And can you tell me what you smell?
Vanilla.
Yes, very good. So here I have vanilla extract. So we're gonna go to the mouth. When we look at the mouth, we also look and see it's midline, lips, symmetrical, pink, no lesions of any sort, no sores noted, nothing in that nature. I'm gonna actually have the patient, I'm gonna assess for cranial nerve 12, which is the hypoglossal nerve. And with this, the patient is gonna stick her tongue out for me. We're gonna assess for cranial nerve 9, which is the glossopharyngeal nerve. And with this, the patient is gonna say ah. Okay. With this, it's also good. Let me get gloves on. Actually have the patient do that and say that when the patient says ah, because you could look in with a pen light and see. So my pen light's here. Also, I don't have a tongue blade, so a spoon will be suffice for the video. So the patient's gonna open her mouth. I'm gonna use the pen light. Okay, just open your mouth. I'm just gonna be taking a look. It's nice and pink, moist, no lesions, no sore, no bumps of any kind, no dental caries, no broken or missing teeth. So in that sense, everything is good. I see her uvula is midline and it is intact, and it moves up and down. So also when you're in there, you want to look at the soft and hard palate. Now for the cranial nerve 9, I should have kept my glove on, but it's okay. I'm going to have the glossopharyngeal nerve. I'm going to have the patient open up. Okay, say ah.
Ah.
Stick your tongue out. All right, and lift your tongue up. Good. So you assess that as well. This is also when the gag reflex is being tested. So you could kind of just put an object back there. My patient declined to for the video, but you could kind of just put a tongue presser and move the tongue presser a little back, and that's how you would test for the gag reflex. Cranial nerve 10 is the vagus nerve, and for that, you're going to ask the patient to swallow. So I have a cup of water here ready. My patient's going to just take a normal sip of water, and you look and see that she's able to swallow. And right after that, you could actually look at her neck. So you see, once again, there's no lesions present, no masses, nothing like that. you begin to palpate. So you check and you see the trachea's midline. Everything's normal. Cranial nerve 11 is the accessory nerve, and you're gonna have now this patient move her head left and right. So you just, very good. And then you're gonna also have the patient shrug her shoulders up and down. Okay, and you wanna do that against resistance as well. So move them up and down. Very good. So that was cranial nerve 11. To assess the lymph nodes, and you could start out with the pre-auricular here, and you would wanna do this bilaterally. So you start out here, which is in front of the ear. Any tenderness or pain?
No.
Okay. The post-auricular, any tenderness or pain?
No.
The occipital, any
No.
tenderness? No. Okay. The submandibular, and then you have the submental here. So you would assess that, and then you would move on down. You would keep assessing all the lymph nodes. Then you come here to the supraclavicular, which is above the clavicle, and you also assess them, any tenderness or pain.
No.
Palpate her carotid artery. So for this, you only do you palpate one carotid artery at the time. So we're gonna start out here, present, and 2, no, okay, present, and 2, plus 2, okay. I'm gonna take my stethoscope and I'm going to now listen. I'm gonna listen with the bell of the stethoscope. So for here, you're able to hear if there's any bruit in the carotid artery. So you're gonna have the patient take a breath in and out, and then just like hold that breath. So take, okay, and again. Okay, so no bruit present there in the carotid artery. Move on down to the lungs and the heart. For video purposes, since my patient is a female patient, she will not get undressed fully, but I will explain on what we should look out for if this was performed not on a video. So let me get my stethoscope again. So basically, we look at the anterior and the posterior. We inspect the skin. We once again look for chest rise and fall symmetrically, as she breathes in and out, which is normal. There's no retractions noted. She's not using any accessory muscles to help her breathe. We're gonna start out by listening to her lung sounds. So let me get my stethoscope on. Okay, so breathe in. Okay, breathe in. Breathe in. Okay, you could just put your legs this way and stay seated, so this way you could get, very good. So we could see the patient's backside, and I could assess posteriorly her lung sounds as well. Okay, using the diaphragm once again. Breathe in. Okay, breathe in. Good. 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 So the right lobe has 3 sides, where the left lobe has 2 sides. Then if we're going to be, the diaphragm is used to listen to, there was no murmurs heard. The diaphragm could be used to listen to heart sounds and lung sounds, where the bell is to listen to heart murmurs. So now I'm going to start doing the cardiovascular assessment, and I'm going to go into the 5 cardinal points. So we're going to go to the, start at the aortic. It's going to be hard for this because usually you want to do this on bare skin when you're listening to heart sounds. You hear it better. You can't really hear it through clothes, but for video purposes, everything will be normal. So I'll just guide where the points are. This is the aortic over here. Then you move on, you go to the pulmonic, you go to the Erb's point, you go to the tricuspid, and then you go to the mitral. So at the mitral, it's the apical pulse, and that's the maximal endpoint. Over there, you could hear heart sounds the most. Also, when you are listening, you should be listening for an S1, S2 sound, and that's what we get. Then when you continue on with the cardiovascular assessment, you assess her fingernails. So you would want to compress her fingernails, and it will blanch. And once that happens, that's how you want to make sure the blood returns back. So it's less than 3 seconds, and you do that for each single fingernail as well. And you keep doing that, and keep doing that. And she had less than 3 seconds, which is normal. When you assess the legs, the extremities, you're looking for any kind of edema, you're looking for any kind of varicose veins, you're looking for any swelling, tenderness or pain. So I'm touching the patient. Do you have any tenderness or pain on your legs? Any tenderness or pain? Okay, and so over there you also assess the capillary refill, and you do it on each toenail. Now when we look at the arteries, when we want to palpate and auscultate the aortic artery, we are going to palpate right here, and then the renal artery is over here. The iliac, and you go down to her femoral artery as well. So with that being said, overall, I have a very healthy patient.